When I've completed orthodontic treatment on a patient, I will often make them aware of the fact that retainer reviews are available once every 6 months, once every year, where we check their removable retainers to see if there's any cracks that we can catch early to negate the need for them to have replacement retainers. And we will also check their fixed retainers to see if any of the glue has worn away or broken or the wire is detached from some areas. And this is something that often patients cannot detect themselves. I am cognizant of the fact, however, that patients often have spent on orthodontics and they might feel that this is a level of upsell perhaps that they are uncomfortable with. The intention isn't that. I would say that retainer reviews are not a large income generation scheme for myself when you compare it to the money that you would make straightening people's teeth. And one could say that in a sphere devoid of ethics, that I would probably encourage people not to wear the retainers because I could treat them for a second and third time. I remember when I used to work in America, it was much more acceptable for people to have what we would call top-up treatments. Personally, I see that as a fairly demoralizing prospect, that I've straightened someone's teeth and they come in to see me again for a result that did not stick, when the reality is that they've just aged and perhaps they weren't as good at their retainers as they thought they would be. And here we do see a relatively high number, especially NHS patients who seek retreatment, partly because fixed retainers weren't provided in the first place. But my ideal situation would be to feel that once I've straightened someone's teeth once, that is how they will stay for the rest of that patient's life, or at least for the rest of that patient's life where it is a priority to them to have straight teeth. For that reason, I would recommend that you see either myself or another specialist orthodontist to check the condition of your removable and fixed retainers. Some dentists are comfortable reviewing fixed and removable retainers and even repairing them, but most that I work with are not. So I would suggest for you to be sure that you are getting reviewed appropriately, go and see a specialist orthodontist. Each time that you attend for a retainer review, make sure you bring both your removable retainers and any spares that you might have. Because if we are ever repairing the fixed retainer wires or the glue around the wires, we need to be able to retrofit that to your removable retainer. Otherwise, you won't be able to get your removable retainer back in around the repair. So that is very important. I think annual reviews are good value, preventing you from ever needing your teeth straightened again. However, if you don't feel that they're good value or they're not particularly affordable for you, I will now include a number of ways in which you can check your retainers to minimize the risks of encountering problems. This is a short tutorial on how to check your retainers. Use your thumb and fingers to gently squeeze around the periphery of the retainers on both sides, and gently flex the retainer up and down and in and out. Feel and listen for any cracks, as you will hear now. Many cracks and holes don't need repairs, but please alert us to these. Fixed retainers are unfortunately not possible to check yourself, and you would have to rely on an orthodontist to do that for you. Bye now.